You're good. You're good.
Okay. All right, cool. I wonder if I
All
can
right.
just turn that shit on.
All right, we're live, man. We got Joel Vengco here. What's up, Joe? How you doing?
Hey, good, David. Thanks for having me.
Yeah,
Busy today.
so what I thought will be fun is we usually will take our offline discussions online just so people can hear some of the cool stuff you're doing. Obviously, the TechSpring stuff is awesome. The Baystate work you're doing with the frontline heroes, that's always great work. And all the technology you guys are putting in the last few weeks has been
Yeah.
changing the industry. So, just give folks a quick background about yourself, and then we could just talk about what's going on in our life, including your girl band that's probably going to be an all-star feature soon.
Yeah. Hey, everybody. Joel Vengco here. David, thanks for having me. It's a pleasure, as usual. I'm the Senior Vice President and CIO of Baystate Health, a large health system in Western Massachusetts. And as David had mentioned, lots of work going on the technology side for us. Certainly, as I like to say now, the future has crashed in on the present. We're doing a lot of work that, quite frankly, many CIOs, including myself, have really been kind of spearheading in our organization. And so the reality is now today is what we've been preparing for. And so it's been quite a fun journey over the last several weeks. Well, in terms of being a contributor to really what's going on in healthcare, which is really the evolution that I think we've all been anticipating. So it's been really interesting. And prior to this, David, I was, as you know, I worked at GE Healthcare in a division called eHealth, which is really focused on kind of new tech for population health and analytics. And then prior to that, I've sort of been in and out of provider and vendor, really with an entrepreneurialism and kind of an innovation, bet to what I've been doing. So I'm really excited to be here with you today.
Yeah, what's interesting is what you just said. Now we're in the reality. So, do you think work from home is going to be here to stay? You think we're going to be allowing organizations just to keep that going? I mean, the next 2 months, people have been accustomed to work-life balance. They're able to do stuff at home while still being productive. What do you think?
It's so I've always thought that it's certainly something that we should explore. But with all things in healthcare, as you know, as a technologist, it's only when the partners, your partners, or some people call them customers, we call them partners here. But when your business partners come to you and say, "Boy, this is a really interesting thing," and in this case, they ask the question, I have staff members who are feeling and looking more productive. What are we going to do about that? Are we going to persist that work from home scenario, or are we going to ask them to come back? And so it's really interesting. And so once they start having that kind of discussion and discourse, and then they start talking about the footprint internally, they're saying stuff like, well, maybe we have less parking spots that we have to build, and maybe there's a less expense on workstations or cubicles. You start to realize that they are thinking about it in that fashion. And so I think the reality is that there's going to be some segment of the workforce that will be perhaps working from home going forward, or at the very least have more of an ability to do so. But with like all things in healthcare, though, our partners want to have proof that things are working, right? They want to know that people are being productive. And so now the question actually is, can you provide me with data that proves that our folks are actually being productive? And so we're actually working on that now, and working with HR on trying to figure out how to measure productivity when they're at home. And I think the anecdotes, at least the feeling of the business leaders, is that they are actually more productive. So now we just have to get the analytics in place to sort of show that in fact they are being productive.
Yeah, that's very interesting. So, obviously, personally for myself, I've been working remotely across the world for the last year. They have never asked me to show productivity. It's all about delivering, and a lot of the work I do is at nighttime due to the time zone difference. So, being on phone calls. But it's interesting when the organization wants to have productivity to be able to show that they are working, whether, I don't know, are you logging in, how frequently they're accessing the system from that perspective, or there's got to be other measures?
Yeah, we started to use actually our multi-factor authentication data just to know that they're actually logging in, because with that data, we can actually figure out if they're using our what we call MIDA, which is My Desktop Anywhere, our MIDA product, or if they're logging into Microsoft 365, even if they're logging into Outlook online. That the MFA will give us information on whether or not they're actually doing stuff, so to speak, right? So
Yeah.
we've been using that data from that perspective, but we haven't gotten deep into figuring out, are they opening certain applications or are they doing certain things? We see call center volumes, be where they typically are. Actually, they're rising in many ways, and the abandonment rates are a good indicator of whether folks are actually answering calls and doing their job. And we haven't seen a decline in that. In fact, we've seen, I think, more satisfaction from our contact center folks, for example, because in the past they had to come in physically, and there's some of them that were off remotely, but the majority of them were coming in physically, and they would sometimes have to call in sick if they had a child issue, a child problem, child care problem, or if they were truly sick. But now it's, they feel that they can do this remotely. All of them can do this remotely, and they can be productive at the same time. So, and we're seeing that across the board. We're seeing that in our service desk. We're seeing that in our coders and our HIM employees. And so there are a lot of other folks who payroll, for example, or finance. And so there's a slew of folks that are realizing, gosh, I really can do this from home. Now, if we could only get them to stop printing, I think that's the thing that, it's like, why do you need to print? Who are you printing it for? But I get it. Sometimes, old habits die hard. And as long as they're not printing PHI, I suppose we're okay with that. But we did have a mandate at first, no printing at all when you're off site. And we kind of got convinced by some folks that it was helpful to them or relevant to them, particularly in their current work. So we allowed some of that to happen.
Yeah, I haven't thought about the printing, especially the amount of toners people are going to have to buy and expense back, because it's not like they have commercial printers at home either. So just
Right.
imagine that volume.
Yeah. Well, that's part of what I think, working from home is going to have to lead to is there's going to be some level of training still in terms of what does it look like? How can you do work differently? And I think that's where we're starting to really look at redesigning, your employee portal or your employee desktop, and trying to figure out how we can, get more folks to adopt soft phones. Try to figure out how to get more folks to adopt e-signature capabilities. These are things that, I think now are being forced upon folks to really adopt. And it's our duty as technologists to try to come up with the most, seamless workflow for them, even though they may be, more used to doing things, their old way, and just in a different environment. And I think there's going to come to a place where we're going to have them really adopt the technology in that way if they're to work from home. And I think that's where we have the conversation with HR. When does productivity become, impacted because they just don't know how to utilize technology, or we haven't given them the tools in the way that they should be given to have a seamless workflow.
Yeah, so this is very interesting. Obviously, talking about the ability to scale out. So just share with me how quickly you were able to scale out. But most importantly, I want to get into the TechSpring stuff, because that's the thing that I would say people should recognize the value of your innovation center and how you operationalize it. So let's talk about how you scaled out quickly within the organization, and then we'll get into your innovation center.
Yeah, sure. So actually, there's a little bit of an intertwine with TechSpring and the work we've been doing at TechSpring, the Innovation Center, and the platform that we use for MIDA, our My Desktop Anywhere platform. So when we first got into this crisis, we probably had maybe 650, 700 folks with MIDA access, and we're working from home, when they needed to work from home. And so as much as we tried to scale that, we ran into a number of situations with, for clinical users, because as you know, some of these old legacy clinical applications just don't work on like Win 10, for example. And so, um, for the last couple of years, we've been doing a lot of work to test it, to try to work with the vendors to try to create wrappers around those applications that might not work natively in Win 10. And I think the team did a great job successfully working on getting all of the components to work with MIDA, to work with Win 10. And it was really just in the nick of time, quite honestly. As we got into this crisis, it was like, okay, now we got to go from 700 to 4,000 in less than a couple of weeks, right? And maybe even more, because we actually have folks on site who are using that remote technology, off-prem technology, and we needed to scale up. And so we scaled up to about 3,000 users, actually 2,500 users first in the first week and a half, then 3,000 in the next week, and now we're probably over 4,200. We've got 13,000 employees, let's call it, and so about 4,200 work from home, on a regular basis concurrently. Our VMware platform did really made us it gave us the ability to scale up at that level quickly, and so we couldn't be happier with it. We actually did end up borrowing some hardware from some other applications that we had because we didn't have all of the iron that we needed. So we ordered that. That took about 3.5, 4 weeks to come in from our vendor. But we had enough capacity and compute power from other applications that weren't using some of our hyper-converged architecture to really borrow from that capacity. And now we're sort of returning that capacity as we've brought on the new hardware. And so right now our capacity is probably closer to 6,500 users concurrently, which, as as we hopefully get out of this crisis, that number will be more of a 2 to 3 to 1 scenario. So it could, in fact, leverage, or we could actually give, this type of remote capability to all 13,000 employees. So it was quite a ride, but our teams were prepared for it. They'd learned lessons up to this point, and they were able to really transition that into execution.
That's awesome. All right, so
Yeah.
now let's talk about TechSpring. So obviously, I had the luxury of coming out to spending a day with your team at TechSprings, learn the backstory about how you were able to put together a quick financial model over a napkin with the governor to get the initial
Yeah.
funding. So that's kudos. I mean, not every CIO can really do that and even have the chops to put that business plan together and while building a relationship. So you're 5 years in the making now with TechSprings. Is that correct? About 5 years, going on
Yeah.
5 years.
Yep, that's
And
correct.
and what is the differentiator in terms of TechSpring versus other innovation centers that I have seen throughout the US is your ability to operationalize it and solve real world problems. So talk to me about some of the things you've been doing in terms of those real world solutions, but also how did you use it during this pandemic as well?
Yeah. So the basis for TechSpring was to really the idea was to convene a global community of innovators who could work together to solve what we call passionate problems in healthcare. And not that I didn't think that we had a lot of smart people here at Baystate Health. It really, if you think about Massachusetts, we like to think that we're sort of the hub of the healthcare universe. But I thought that, as we all believe now in our generation, crowdsourcing anything is certainly better than having a smaller, subset that kind of working on something, because you discover things faster, you learn things faster, and you can perhaps even create things much more quickly. And so to create a global community of innovators and have them really utilize the assets of Baystate Health, the data, the environment, the employees or experts, was really the focus. And identifying what we call passion problems, which are really in many ways operational issues that we see on a day-to-day basis, but also larger sort of strategic problems, was really kind of the area of focus. It wasn't about investments. It wasn't about making money. It was really about transforming and evolving healthcare through the use of what I like to say, informatics and technology. And so, that was the basis for building TechSpring. Luckily we had a great legislative body here in Massachusetts who really sort of saw that vision and helped us at Baystate, bring to bear an amount of funding, capital funding, to open up a 10,000 square foot space, but then also kind of challenged us to create an operating model that enabled it to be self-sustaining, and one in which we ended up creating what I would consider a kind of original and kind of innovative approach to funding this type of innovation work. And so a lot of it is a sponsorship model, with either vendors or innovative partners. And the idea is to leverage our assets as an extension of their product development capability. And so in partnering with them, what we found is that we could solve our problems simultaneously while they solve their problem of proving out their technology. And I like to think of Baystate as a very representative health system to many of the other health systems out there. And so the hypothesis was, if it worked here, it would work in the majority of health systems in the country. And different from some of the larger players out there who've got great innovation centers, but certainly I think our environment being kind of representative of the rest of or most of the health system industry, because we're mid-size. We've got a lot of pains culturally. We've got a lot of pains technologically, to go through that sort of those barriers and try to push technologies through has been, I think, a learning experience, and one that we love to share with folks who look like us. So we've had a lot of great successes, particularly as we focused on improving, for example, provider workflows. And that sort of first project was one that we worked with Dell on, and they introduced us to a company in India who had an interesting sort of let's call it a refacing app technology that sat on top of our EHR to enable clinicians to have a more sort of explicit and seamless workflow than they may have going through a bunch of clicks on their current EHR, and one in which they can have it on a mobile device. And so we worked with them very quickly and with our users to come up with a solution to that problem of how do I access my patient information on the fly, as well as document, as well as order, et cetera, and do it on a technology that may or may not be fully open. And so we worked with them on that, and they came up with a tool called Praxify, and it's been a tremendous boon for our clinicians. Excuse me for using this term, it was so viral that people wanted to have it in their hands, right? When clinicians ask you for the technology, or they say, "How come I didn't get this? This is, I'm really disappointed that I didn't get this." That something is going well. And then that technology got bought by another EHR vendor who will be unnamed, but it was for a lot of money, let's just say, and that was never the case, or that was never the intention initially. The intention was to do right by our users, our business, solve a passionate problem, and then if good outcomes came about it, that was great, and in this case it did. We have a number of stories like that where we really focus on the problem rather than the solution first, and so it becomes a technology pull by our business partners than a push, and that's really been the secret sauce for TechSpring in many ways. But with all innovation, and I'm sorry to keep talking at length here, but with all innovation, you need process and structure. And even though it sounds like it can be a sort of a jazz, solo, or it's sort of free for all, and it's sort of you're innovating as you go along, there is a need for structure and framework and process, and that's what TechSpring has really discovered over the last several years is, what's the intake process? What's the passionate problem matching algorithm? What's the assessment of technology, or what we call sort of our tech cascade process look like? Then how do you bring legal and compliance in so that it's not such a slog to sign off on data use, for example? And then how do you integrate that into operations? And that's really kind of what the framework has evolved over time and has become a very seamless process for us, which leads me to, if you want, I can talk about how that sort of translates into the COVID process
Yeah.
or the COVID crisis. And it's that framework and those lessons that we've learned with TechSpring has really enabled us to use the TechSpring methodology during this crisis. And while most of my team had been focused on the day to day, focused on solving the problems of today, I had a team that I could ignite to basically look at even the next week or two out, right? And in many ways, it's a microcosm of what we see in our in our normal day to day affairs as an IT shop, where you have an operational IT shop, and then who's looking at the horizon, right? Who's looking at the 2 years out, 3 years out? And oftentimes you're so invested in the day to day, you can't really pick your head up. So we leverage that same kind of process and paradigm for this crisis, which who knows how long it's really going to go for. But we thought this crisis could go for a month, it could go for 3 months, it could go for 5 months, but somebody's always got to be looking ahead. And so TechSpring and that team was what we called our horizon planning team. And so as most of my team were focused on fighting the fires for today, things like expanding our usage of remote work or making EHR updates. We had a team that was focusing on, how do we transition our video technology to create a family video chat capability? How do we create a what we called initially the virtual glass door, but it was really about clinicians going in and doing a quick connect video with patients who were PUIs or they were COVID positive, and we wanted to reduce the use of PPEs. How can we take a snorkel mask that we've been seeing around, and really transition that into an N99 mask with a 3D adapter, 3D printed adapter. And those are some of the things that we did end up doing with TechSpring. We had a team focused solely on that while we were still getting stuff done. And so that, I think, is really a huge, in my mind, a huge success for any health system who has an innovation group or an innovation capability, because now you can work bimodally, continue to solve the problems of today while you're looking at the horizon for tomorrow's problems that are incoming.
No, that's great.
That was a mouthful. Sorry.
No, that was great. I think those are great examples. And the biggest differentiator, as you mentioned, is you have the playbook. So I'm also glad to see that there are other healthcare organizations joining the TechSpring network, right? We have LifeBridge down in the Baltimore region.
Yeah.
So how would an organization, for example, the organization I'm currently with, VA Medical, that has facilities throughout the world in Australia, Singapore, and looking to build some hospitals in Shanghai, how can they get involved?
Yeah. No, like you said, one of the things that we have at TechSpring is this, as you called it, a playbook. There's sort of the secret sauce, the framework that enables one to take in an idea and then bring it through the life cycle of what we're calling innovation. But really, in many ways, it's really taking something like an idea about how to use a technology, matching it with a passionate problem, and then taking it into operations. And so we have that process, and we certainly thought that would be worth sharing with others who are looking to get into this space, and at the same time not spend, but for those who can't find, $20 million, $100 million to put into an innovation center, we felt this would be a solution that they could leverage and share with us. And so we're starting to create this thing called the TechSpring Network, as you had mentioned, and it's really this idea of creating a coalition of health systems that have that kind of pedigree, that want to identify passionate problems and try to solve them, share those learnings, work in a network where you're sharing either vendor collaborators or innovation collaborators, and see if we can identify similar or different outcomes with these technologies because of the different environments that we have. And so, right now it started with Baystate Health, and we've got, as you mentioned, LifeBridge, Tressa Springman, who's the CIO down at LifeBridge, who's a terrifically innovative CIO and really sort of leading edge in the way that she thinks about operations as well, had signed on, and it's been about a year now that we've collaborated with them, and we're now just really seeing the fruits of the labor that I think both parties have put in, which is let's put the framework in, and let's begin to solve some of your problems. And so it took us 3 years to really sort of come up with that framework and really get TechSpring up and running to its extent. And we're accelerating that for her because of the learnings in the framework that we have, the playbook that we have, and we invite others to join. The two of us organizations. There are the others that are asking to be a part of the network. Certainly, we're looking to grow it, broadly, so that we can see how technologies impact other health systems. But we're also aware that there's in many ways there is a level of a characteristic, if you will, of health systems that want to play in this space in the way that we are, which is to say, it may not necessarily be about investments. It really truly is about making a difference and impacting healthcare through the use of technology. And it's in that sort of product development or in that sort of innovative, paradigm that we're really looking to evolve the network.
Yeah, that's awesome, Joe. Appreciate your time. I know we both have things to do. We have a real job in this instance, sharing what's going on in the world, but always appreciate you sharing some of the innovation stuff going on at TechSpring. Thanks, buddy.
Yeah, pleasure. It's my pleasure. Thanks a lot, Dave.
All right.
Be safe.